I remember that first moment when you knew that it was time to start a new practice.
I think it evolved over time, but there were some key things that we realized that we really wanted to be forward-thinking and think about that patient experience and not just let it be just about the doctor, but really centered around that patient.
It was a tough decision, but at the same time, we knew it was the right decision, so I think at some level, it really was an easy decision as well.
Someone that's been with me for a long time is Hannah, and Hannah's been a great person, I feel, on the leadership squad, getting us forward thinking and moving stuff forward.
Hi, my name is Hannah Johnson, and I'm the Chief Strategy Officer at Vios Fertility Institute. Starting at Vios at the very beginning was definitely one of the most interesting, challenging, and rewarding experiences.
We sat at that kitchen table and on back of napkins and papers, we sketched out some of our early thoughts on what we thought this was going to look like.
I remember I think it was the fall of 2015 when we started opening in St. Louis, and it was so fascinating how we had come from the plans and the thoughts and all the ideas to actually having a clinic open in St. Louis. And then we had these two spectacular doctors who wanted to practice in St. Louis and wanted to be part of this.
I started with Vios St. Louis in 2015 when we first opened our very first Vios Fertility office here in St. Louis.
If you remember when we were opening Wicker Park, the first location here in Chicago, we were on a Saturday afternoon, we spent the whole day putting together furniture, and it was all of our staff and all of their husbands, wives. They also felt connected to building a practice that could take care of all these couples and all these future families.
When we built our initial nursing team, we had been blessed to have some of the top nurses. They were all in. In the fall, actually, of 2017, we then had a whole nother set of doctors that joined us and new locations. It was also an opportunity to extend north.
Someone on the phone is in an emotional state. They're frustrated, they're upset that they're not able to conceive on their own.
And by having a call center work together at all locations, that team can focus on that very first visit.
I think that anyone who works in the field of fertility, especially those that have worked in the field for a while, has this deep sense of purpose and passion. But as we know, when you have that deep sense of purpose and passion, you have to be surrounded by people who lift that up and support it. Because in order to have a patient feel that power of the passion, they need to see it in every person they interact with. It doesn't matter if the physician is amazing, and it doesn't matter how incredible their nurses are. You need each person that a patient interacts with to have that shared passion and to show it in every interaction.
I love the term Vios family. It sets a tone to say we all care about each other, and we all are in this together, and we're all working for a greater good. And that greater good is not just getting home earlier or getting out the door or punching a clock. It's really about taking care of the patient and making sure that the patient is always the first concern for whatever we're doing.